So these are the known risk factors for violence. And the reason I'm emphasizing this slightly is because these are the factors that we're wanting to work on when we're thinking about changing violent minds. These are the factors that you would want to change if you're interested in changing a violent mind. Now, being young, male and socially isolated is not something that a therapist may be able to do very much about, but it's important to think about, again, from a policy point of view and a political point of view, both at local level and at a national level. What can we do about violence among young males? What can we do about social isolation? Paranoid mental states, that is probably fairly obvious, is that if you're in a paranoid mental state, you believe that you're at risk from somebody else. And people who are in states of fear are much more likely to act aggressively towards other people. Substance misuse is a potent risk factor for violence. Some of the old studies suggested that as much as 80% of acts of violence involve one or both parties, both perpetrator or victim, being drunk. And of course, illegal drugs similarly increase risk because, A, because they increase the risk of people being paranoid, but B, because they distort reality. So if you're paranoid and your reality is distorted, that's a potent scenario for violence to occur. Anything really that distorts reality is a potent risk factor. Hypervigilance, really that's another aspect of paranoid mental states. It's worth noting again in this context that trauma, previous traumatic experience can leave you hypervigilant. And so there's been a lot of interest about whether the experience of trauma, things like PTSD, can actually increase your risk of acting violently. And there is a little bit of evidence from studies of veterans that people who've been exposed to traumatic violence, actual battle violence, are slightly more at risk of developing a type of PTSD that increases their risk of violence when they return. Insecure attachment, and by that I mean disturbances in early childhood relationships. And I'm going to come on to say a bit more about that. But there's an increasing literature over the last 20 years in particular, which has looked at adverse childhood experience. And we know that adverse childhood experience, if you have 4 or more different types of childhood adversity, that significantly increases your chance of acting out violently in adulthood. And insecure attachment to one or other of your carers may well be the mediating factor here, because attachment is the way that you formulate relationships and actually also use other people when you get stressed. And finally, that whole idea of an antisocial state of mind, a state of mind in which you don't feel connected to the social. You don't feel connected to that group of people, their community of values in which you support sharing rules or feel connected to the rules. You know, that one of the reasons that most of us in this room keep the rules and the laws is not simply because we're worried about what trouble we'll get into, but also because we feel some sense of commitment to the group who holds those laws and rules, and which is why rules and laws are hotly debated, and quite rightly so. But people in antisocial states of mind, often because they're socially isolated, often feel very disconnected from those social values. And Isaiah Berlin had a nice sort of phrase about a community of values. And although he was talking about people with mental illnesses being isolated from a community of values, I think there are people who can get into very antisocial states of mind, which are very similar.